sponsored by Appalachian Health Plan Advisors.
Well, this is an important time for seniors as Medicare open enrollment is now underway. This is the time to navigate the different plans to find out which one works best for you. But that process can be overwhelming. Zach Choate with Appalachian Health Plan Advisors joins us now on the show with more information. And Zach, great to have you on Daytime.
Yeah, thanks for having me, Amy. I appreciate it.
This is sort of your Super Bowl.
Yeah.
This is a busy time for you, as this is really important.
Yes, ma'am. It absolutely is. And it's something that I truly enjoy. I mean, there's no better feeling than meeting with someone or going to someone's home and knowing that I'm either saving them money or getting them access to benefits that's going to positively change their life. I've been doing this for over 15 years now, and I'll never forget one of my first clients who dropped 40 pounds, totally reversed his diabetes after I enrolled him in a policy that had a gym membership, and he actually used it. So that was nice. Yeah,
so these plans can make an ultimate difference in someone's life,
yes,
making sure they're on the right plan. And you sort of have that position where you can look at all of them.
Oh yeah. Exactly. So I'm an independent agent. My team's independent. We contract with multiple companies. And so we're not going to pigeonhole you into one specific plan. We want to look at your medications. We want to check your doctors. We really want to be more like educators and partner with you before, when we help you to find some type of coverage that's going to work for you, but then also after the fact too.
So Zach, as you're working with these folks, what do you see as some of maybe the common mistakes that people make?
Yeah, absolutely. So I think people just get overwhelmed with the process. Like if you're going to read the disclaimer that's on the TV and it shows all the different plans that we offer, that's really overwhelming. And so I think what happens is people just try to either just pick something randomly. Maybe they ask like their uncle or their brother what plan they have. And instead of actually calling a local professional, someone who does it every day, who can navigate the plans and help them choose something that's going to fit for them. Like, I love my brother, but I'm not letting him do my taxes, and I'm not letting him choose my Medicare plan. So.
And I bet through this you really build some relationships with people and get to know them. And I understand too, the plans change year after year.
They do. They do change every year. That's why there's an annual enrollment period. And the government, they're really nice people. They give you plenty of time. You got October 15th through December 7th to give us a call. And so, even if you already have a plan, or maybe you've already chosen a plan during that time period, there's always time for a second opinion. And we love to partner with you in helping that person pick out their Medicare plan. And then even, beyond December 7th, we keep working. People are turning 65 every day, or they're new to Medicare, and if you happen to forget when you're turning 65, there's people that are going to start calling you, letting you know you're about to turn 65. You'll get a bunch of mail letting you know, and that again just adds to that kind of complicated, overwhelming process when you get all these different options. And so that's when you remember to call that feller that you saw on Daytime,
yeah.
who can come help you out.
Because you're, like you said, your phone is going to start ringing, and a lot of people have an investment in this. They're selling a particular plan, so someone like you is able to really take a look at what those plans offer. Oh
yeah, absolutely. Yes, ma'am. I mean, we have different computer programs we use where we put in someone's medicine, we look up someone's doctors, and we can actually find out what's important to them. Which benefit are you looking for? What's going to make the greatest impact on your health? And that's what we want to do, is kind of have that personal one-on-one relationship with someone to help them choose what's going to be right for them.
And of course, one of the things our viewers may be thinking is, well, if I go with someone like this, how much is it going to cost me?
Yeah, no charge at all to work with us. All you have to pay us is your attention. We actually just receive a commission from insurance companies if we are able to help find a plan that's going to put you in a better spot. And so you don't pay us anything at all, but we do receive something, and that's because we're supposed to service you. Something that burns me up is when someone says, says, oh, well, my agent says I just need to call that number on the back of my card, and that's not right. Like, you should partner with an agent who's going to help you on the backside too, and provide that customer service for you.
Well, certainly some important information this morning. Zach, thank you so much for joining us. And if you would like more information, you can get a hold of Zach by checking out the website. Very easy. You can go to appalachian.health for more information.
The preceding segment sponsored by Appalachian Health Plan Advisors.